Nino asks a question here live on YouTube. Nino asks, Dr. Ben, do you think that the FDA will bring something on that will cure tinnitus? My answer here is probably not in the next 3 years. I don't see anything in the next 3 years as an FDA approved cure for tinnitus. And that's about as far as an outlook that I have. It's hard to really say what can be a cure for tinnitus. There's different causes of tinnitus. There's different representations of tinnitus. There's different subtypes. And it's a very tricky medical condition to cure, right? I could almost respond and say, well, when do you think the FDA will have a cure for anxiety? I don't know. Is that even possible? Part of me wonders if it's even possible to have a cure for all kinds of tinnitus. I think that the research so far is looking specifically at tinnitus related to hearing loss and tinnitus related to certain medical conditions, treating hearing loss, trying to find a cure for hearing loss. That's where the research is headed. An FDA approved cure for tinnitus, first of all, it's never existed so far. Second of all, there hasn't been any FDA approved pill for tinnitus. And there have been some FDA approved technology treatments, neuromodulation, bimodal stimulation should be coming soon. That's not a cure, that's a treatment. Having a cure for tinnitus is very hard. It's almost like I said earlier, having a cure for anxiety, having a cure for headaches. This is such a common medical condition that's so intricately tied to the brain, that has a lot of networks in the brain that are rather tricky to try to isolate and pinpoint. So even though the FDA does not have any cures, or there's no research towards a cure in the immediate future that I see as becoming, clinically relevant or entering the market, I want you to focus on what can be done, which means you have to understand you have some control in this. You have sound therapy you can adjust, improve, optimize. You have cognitive tools. You have psychology that is your friend. Always bet on the brain, people. Always bet on the brain. Psychology, your own mind can make improvements here. That's why CBT is an often cited tinnitus treatment. All right. Cognitive behavioral therapy. You can change the mind, the thought patterns, cognition. You can change your behaviors. How do you use sound therapy? Where do you go around sound? How are you preparing for sleep? You can use mindfulness. You can use a holistic perspective. All of that has a place to improve tinnitus. So until we have a cure, we're going to double down on what is in our control, which is psychology, the sound therapy, and the holistic path. Please use professional counseling because it helps so much. And you don't have control over the exact loudness of tinnitus in the moment. You don't have control of if you're feeling anxiety or nervous or anxious or sad about your tinnitus in the moment, but you can control your future outlook. You can control your knowledge and information on this, and you can control what tools you're using to manage it. So please, my friends, double down on that. Thank you.